Okay. All right. So, hey, everybody, I'm Lauren Fleming, the founder of Him Supportwear, and I'm here today with Dr. Beth Olson to talk all things pelvic health. This is part of our expert spotlight series where we get to know healthcare professionals in the pelvic health community a little bit better and get to have a peek behind the curtain to what their daily life is like and share their insights on pelvic health. So, I'd love, Dr. Beth, for you to just give us a quick intro to who you are,
Sure.
and what you specialize in.
Yeah. So, like you said, I'm Dr. Beth Olson. I've been a physical therapist for 13 years now. I practice in Florida, and I have been specializing in pelvic health, coincidentally, ever since I had my son. So, it was one of those experiences where it was never something I thought I was going to get into until I experienced my own challenges with postpartum rehab and returning into working out and running. And I recognized the need for myself. And then once I realized, like, wow, this is really helpful, like everyone in the world should know this, I really started diving into more certifications so that I could start treating in my clinic. And I've been doing that for about 6 years now.
Great. Thanks so much. I can totally relate to it. You being like launched into it from personal experience, because that was how I myself got into this. It was I had my first kid. I was like, what is pop and what is this
Yeah.
thing I'm dealing with?
What is
Yeah.
this
And so
feeling?
exactly. Well, and then you become really passionate about it because it's like,
Yes.
yeah, I mean, it's so impactful and it's so little talked about. And it's like there's
Mhm.
resources out there, but it can be hard to find. And,
Yeah.
I mean, yeah,
I
it's
had
really
no
challenging.
idea what pelvic organ prolapse was before I had it myself. I had never heard of it. So, of course, my first step was Googling, and then that
Yep.
was
Which
best.
is
And then I went
scary.
straight to some colleagues. I was like, okay, I know some people who are already specializing in this. Let me get some good information here.
Yes. Yes. Yeah, that's great. So I know that you practice as a physical therapist and then you
Mhm.
also have some amazing online resources. Can you tell us just a
Yeah.
little bit about kind of what your day to day or maybe week to week looks like, just so we can get a better feel for that?
Yeah. So right now it's the summertime. So I've changed my schedule. My kids are out of school. So I've changed my schedule. So I'm in the clinic on Tuesdays and Thursdays. So I'm in a private outpatient clinic where I get to treat one-on-one with my clients, which I love. So I'm there on Tuesdays and Thursdays, seeing 8 to 10 patients. And then what I've been working on in the background is developing my online courses because I just felt this huge need that more people need this. Like there are so many moms out there that need this information and need guidance, and I can only see so many people in a day. So I wanted to create. It's called Core and Pelvic Floor Foundations. That's my first course, and the whole purpose is that it is laying down the foundational work. I found myself doing very similar teaching and starting in a very similar place with so many of my patients that although I wouldn't call it cookie cutter, it's just information. It's the foundational information that I just really believe everyone needs to start with.
Yeah. Well, I think it's such an important like time to have resources like that too. Cause like I also hear from a lot of customers looking for support garments that are interested in pelvic floor physical therapy, but don't have access to it, like whether it's where
Exactly.
they live or like financials, things like that. And
Yes.
so, yeah, I think it's so important to have kind of all kinds of resources where people can, get the help that they need and, make this as accessible as possible for as many people as possible. So that's very exciting to
Exactly. I
hear
have a
that. Yeah.
lot of new moms. The biggest challenge with my very new moms coming into the clinic is actually just scheduling and making the appointments. It's very challenging.
Yes.
And then, like, we're very fortunate in the town that I live in. There's a good handful of us pelvic floor PTs, but I talk to other people who don't have anyone within an hour's drive of them,
Yeah.
and that's just very challenging.
Yeah, it is. Yeah, I myself drive a good amount of ways
Yeah.
to get my PT, so I can relate to that.
Yeah.
Thanks. So so for people who, may not be familiar with pelvic health or pelvic floor PTs, how do you explain like the importance of it to them if they've never heard of it before? What's just like that quick, kind
I
of
think a lot of people, when they hear pelvic floor PT, their immediate response is like, ooh, like you're going to work down there.
yeah.
Because they're very modest, or they just don't understand what all goes into it. Although I will say the moms that come like within that first year after having a baby, like modesty is a little bit
Yeah.
gone
Yeah,
after you have a
right.
baby. But I would say what I'm looking at is how are we going to get everything working together again. So when we go through pregnancy, there's so many changes to our body. Our abdominal muscles are stretched out. Our pelvic floor muscles are stretched out. How we stand, our postures are all different. A lot of muscle groups get tight, a lot of muscle groups get weak, and we just need to find that balance again. We need to get everything working together again. Because I always explain it like this, like when people come into me and they're having troubles with either leaking or prolapse, or their core is just not strong, things like that, I'm like, okay, here's the 4 pieces of the puzzle. Like, small picture wise, the puzzle's your whole body, but small picture wise, we're looking at your diaphragm muscle, your abdominal muscles, your pelvic floor muscles, and your low back muscles. And right now, each one of those things is in a different corner. And we need to get them all back together and working together as a whole system. Then we can progress your strength. But until these 4 things are actually like together again, you're just gonna be spinning your wheels.
Yeah, and I think that's such a helpful way to look at it, because I think especially like as a new mom, it can be hard to think like, what is happening with my body, because it's so different than before. And so you're like, oh, I should be able to just go back to my strength, training and things like that, and it may not be working, and it's hard sometimes to understand why. So I think, it's very helpful. And then
it's hard
especially
for someone who's not in the rehab profession to understand like coordination.
Yes,
in the way
that's
that
a
I
huge
understand
part.
coordination.
Yes, absolutely.
And so I'm always saying like, well, your muscles need to be coordinated. And people are like, what? And I'm like,
what does
okay,
that mean?
here's your 4 muscles that need to work together, and they're all out to lunch somewhere.
Yep. Yeah, that was like a huge part for me. It was like, oh, I've been doing these things wrong maybe my whole life, or just understanding like, how does this work? Or I've been lifting wrong. And then when you do it right, how impactful that is. Like it's amazing when you can get it all synced up. It's very powerful.
Yes. And I feel like I was like doing those things right, but like completely unbeknownst to, like, I had no idea I was doing those things right. Like, I was an athlete my whole life. I never really had any issues with anything. And I didn't really, honestly, outside of taking anatomy and PT school, when someone said pelvic floor, it meant nothing to me. And so it wasn't, they were probably working correctly before, and I had no idea. And then when they weren't, I was like, whoa,
something's wrong.
Like, I've never had trouble before. What is going on?
Right. Yeah, it's funny you saying, like maybe not knowing what pelvic floor is and stuff, because I feel like when I am talking to people about like support garments and prolapse and pelvic floor, it is such an interesting reaction you get from people, because either they know exactly what you're talking about and can jump right in, or they're like curious but still don't know, or they're like, what is like pelvic floor, what? Or I'll talk to men and I'm like, do you know that you also have a pelvic floor? Like they think it's like just a women's thing. So it's so interesting.
Yeah, no, I do treat men in my clinic also, because men do have issues with pelvic floor. And it's one of the most common things is after having their prostate removed or something like that, is one of the very common diagnoses that I see outside of just like pelvic pain. Yeah.
Sure. Yeah. So it is interesting, like having these discussions and the education part of it. Along those same lines, I'm curious, like, what are some of the most common myths around myths or misconceptions around pelvic health that you feel like you come up with either in your daily life or that maybe you see on social media or things like that?
Yeah. And what you see on social media too, like, I feel like there's this whole debate, like, that I personally see, like, oh, do Kegels or don't do Kegels, and like all this stuff. And when patients come in to see me, they're like, well, like, what is this? Like, don't I just like do Kegels? And my first question was like, well, did you try that? And they're like, yeah. I'm like, did it work? Well, no, or you wouldn't be here to see me. Like, it's just, and I compare it to like pelvic rehab or pelvic floor rehab is addressing the entire body so that the pelvic floor muscles can just do what they're supposed to do without being told. And it's just like your shoulder. Like, if you came in for a shoulder injury, I would not have you just do bicep curls and be like, go home and do 3 sets of bicep curls twice a day for the next 4 weeks, and your entire shoulder complex will be all better. Like, that's just, it's not how it works. It's part of a system. And if you think about how or you didn't think about your pelvic floor before you had any issues, you never thought about it.
Yep.
Because it was working together with everything else so that you didn't ever have to think about it. Like, it just did its job on its own. And that's where we want to get you back to, and doing a muscle contraction like this doesn't do that.
Mhm.
And then they're like,
Yeah.
oh, so that's why that didn't work.
Right.
Or it made their muscles tighter and it made them feel worse.
Worse.
And
Yep.
so they're like, oh, I tried this device that, made my muscles contract, or I did a bunch of Kegels, but it kind of made everything feel worse. Why? And people don't correlate that the pelvic floor muscles can be tight and that can cause
Yes.
issues.
Right.
And I always tell you, when your upper trap muscle is super tight and you like have a headache,
Mhm.
it's the same thing. And
Right.
then they're like, oh, okay.
Yeah. Yeah. I do think that's a huge one, especially, yeah, in that space. Cause yeah, it's like, and then you see too, like, oh, it depends. It's a personal thing. And it's like, it's so true. It can be frustrating to hear that because it's like, oh, well, that doesn't help me, but it's
Yes.
so true that it's like, it's
Hmm.
so unique on what's going on with your body, and different, like root causes can kind of cause similar symptoms. So yeah,
Yeah.
addressing them one way, might make it worse, in fact. And
Yeah. Yeah.
it can be hard to sift through that too. And you're trying to be like, what will
It
help me feel
can
better?
be. And that was a challenge with wanting to develop an online course, is how do I still make it individualized? And I can't say that it's definitely not as individualized as going and seeing a
Of
pelvic floor
course.
PT for a one-on-one session.
Yeah.
But I do have a private Facebook group in the course because I want people to ask me questions. And if someone's
Cool.
saying this is what's happening, I can be like, okay, you stick with this set of exercises
Mhm.
for a little bit longer. Say we're needing to work on more like relaxation and stretching,
Mhm.
down regulation of the muscles. You stick with this group of exercises for another 2 weeks and let me know how that's going before you progress to this. So I
Yeah.
can still communicate with them
Yeah. That's great.
to a degree, which I'll never let go of because I think that's so
Yeah.
important.
Right. Right. Yeah. Especially when I would imagine too, as someone going through it, it would be so nice to have that lifeline of being able
Yeah.
to ask questions and clarify, and that kind of thing. I
Hmm.
think that would be
Yeah.
really helpful.
Yeah.
Amazing. What are some, so I know, like we've been talking about, it's not a one size fits all, but what are like a few of your top tips for like simple habits or practices that people can do to promote good pelvic health more on a day-to-day basis?
I think the number one most important thing, and this is why I start every single person with this, is getting the correct diaphragmatic breathing pattern down. And that's another thing that people come in and they just can't, I have to kind of explain why we're starting with breathing. And they're like, but I'm peeing my pants. And you're
You're
telling
like,
me
help
I'm
me address
breathing like
that.
this. I'm like,
Right.
let me explain.
Trust me.
Because when I was talking about those four things, so your diaphragm muscle, your abdominal muscles, your pelvic floor muscles, and your low back muscles, they all have to be working together. And it all kind of comes to this diaphragm muscle, which is muscle underneath your rib cage. And it's controlled by your brain. So you can't say like, hey, diaphragm muscle contract. Like it doesn't work like that. So you have to train your breathing to be in the correct pattern so that your diaphragm's doing the right thing so that your pelvic floor can follow. And
Yeah.
that's pretty much like the number one step that I start everyone through, because if you're doing that backwards, you can do all the rehab you want. It's not going to produce the same change because
And that
nothing's
makes, yeah, so
coordinated,
much
like I
sense.
was saying
Yep.
earlier.
Right.
Yeah.
Yep. Yeah. Yeah. It's like, yeah, doing something wrong doesn't, yeah, doing it 1,000 times doesn't,
Yeah.
get you where you want to be. It's that if you did it
Hmm.
100 times correctly, you would be making a
Yes,
lot more progress. And that,
exactly.
yeah, it can be really hard if
And
you've been
that's
doing
one of
it
those
wrong.
exciting things where if you can get them to nail down that pattern in like two visits or something, they're like, oh my gosh, it already feels better. I haven't even done a pelvic floor exercise yet. And I'm
Yeah,
like,
that's true.
I
Yeah.
know, it's
Yeah.
that
Well, yeah. And then you
exciting.
start to see it making changes and you're like, oh, okay, I can work on this. This is great.
Yeah, yeah.
Yeah. Amazing. What would you say is one of the most rewarding aspects of your work?
I think my favorite thing, and I actually got to experience this yesterday at work, is when a patient comes in and they're like, guess what? I sneezed and I didn't pee. Or like we live close to Disney. I went to Disney with my kids the whole day and I didn't feel my prolapse at all. Um, I got to, more personal topics like I got to have a bowel movement and like it was
Yeah,
normal.
right.
Like I deal with all of those things. So when
Yep.
a patient comes in and they're telling me, this is really working, like I'm not peeing, like I don't feel my prolapse as much. And I get really excited.
Yeah, when those are huge, and like as somebody that's like dealt with all of those things, it's until you have pelvic organ prolapse or other pelvic floor disorders, it was like I feel like you were talking about earlier, where it's like when it works, you don't think about it. And when it doesn't work, it is at the top of your mind
Yeah,
all of the
you don't think
time.
about
And
it.
you cannot, yeah, it's so hard to focus on other things
Yes.
sometimes because you're just like, I literally never thought about this before. And now I can't like leave it
Hmm.
alone. And especially until you feel like you can start making changes that will actually like lessen it over time. You're like, for me especially, I was just like, oh my gosh, like what has happened to me? What does my future look like? And can I do all these things that I used to do? And it's like I can relate
Yeah.
to that Disney one. We just took our kids on a trip to Florida recently. We happened to be in the Disney area. So we went, and that was like, I was like, I know carting around my two 35-pound kids who are going to want
Mhm.
mom to hold them, it's going to be really hard. And so I thankfully had things like my support garment and pessaries where I could feel more confident that while I'm working to lessen my symptoms,
Yes.
I could have these tools that are often also stigmatized, but that would
Hmm.
really help me enjoy that day and not be thinking about my heaviness while I'm carting these kids around.
Yes. And I used both of those things too early on with both kids. Well, with the first one, I didn't know what was going on for a while. So it took me a while to
Right,
like
take some
figure
time.
out what support garments were. But as soon as I found out what support garments were, I was like, oh my God, thank God. Because and I'll relate. I did wear a pessary. And the first time that, the pelvic floor PT I was going to suggested a pessary, I cried. I was like, I have to do what?
Right,
Like,
right.
what is this? Like, it goes up inside. I felt broken. I felt
Yep,
like, why no one else in the world could possibly need this? Like, what is going on? Come to find out that's not true at all.
right.
Um, Once I found a good fitting pessary, I was like, oh my God, I can go to the gym. I
Mhm.
I can go for a run. Like, and I'm not scared everything's gonna fall out and I'm gonna need surgery
Yep,
tomorrow. Like,
right. Yep.
so I was able to use that while I did all my rehab and got stronger and stronger and stronger. And I'll never forget the day that I ran for the first time without it, because
Oh,
I probably could have sooner, but I was too scared. The first time I ever ran without it, and I was like, oh my God, I just ran and everything feels totally normal. So that was a big deal. And I
amazing.
wore
Yeah, it's
support garment. I
huge.
wore external support garments in the time
Mhm.
frames when I couldn't wear my pessary.
Mhm. Yep.
Mhm.
Yeah, it's huge. And yeah, and I think that would be incredible too to get to the point where you can do something like running and not wear it and feel
So
like
it's
yourself again. Yeah,
I
I mean,
never thought that was
golly.
going to happen. I
Yeah.
honestly thought I'm going to just have to wear this pessary to run. And that's at least I get to
Yeah.
do what I love. And
Right.
I'm so thankful that there's something that helps me do what I love. I didn't think
Yeah.
that I was going to get to the point to not need it. And
Hmm.
when I did, it was just like this extra bonus. Like,
Yeah, right. You're like, this is great. Yeah. What advice would you give to somebody who may be hesitant to seek help from a pelvic floor physical therapist or another healthcare provider in that space?
I think my advice is because a lot of moms just don't put their needs at the forefront because we're so busy taking care of everyone else, is that it is so, so, so important to take care of yourself in this way and to find a way to make it happen, whether that's going to see someone in person, doing virtual consults, because I do virtual one-on-one also, or finding a course, something that you can commit yourself to, because it is so incredibly worth it. It is
Yeah.
so worth it. And I know it's hard because we don't have time.
Right. Which that kind of leads me to my next question is what are your thoughts on, for people who have partners and then so like I am seeking pelvic floor health, what are ways that like partners can be supportive? Because like you said, it's like we don't have time. A lot of times we've got kids or other
Mhm.
responsibilities. Are there ways that you can think of that we can encourage partners to be helpful along this journey?
I think it's incredibly important to, I don't, everyone's relationship is different, but be able to explain to your partner what you're going through and how it's affecting you. Because especially if we're talking about something like prolapse, that's affecting both people most likely,
Hmm.
because there's some
Yep.
hesitation in the bedroom
Yep.
when things are different down there. So being able to explain to whoever it is, this is what I'm going through. And it's just like any other injury. Like if I hurt my shoulder, we wouldn't hesitate to put in the time and the effort to allow me to go to rehab for my shoulder. Or if I had a knee injury, like it would just be common sense that I would need to address this and need the time and the resources to rehab it. It needs to be like that with postpartum rehab as well.
Yeah. I think that's a great point, especially because in a lot of these cases, it's not necessarily externally visible, or maybe it is, but you don't regularly see it. Like I'm wearing a shoulder brace or something. And so I think it can be harder for folks to like, oh, this is a big deal that you're going through. And it can be very lengthy in terms of time or seeing healthcare providers. I mean, yeah, there's just a lot that goes into it. And I do think it's often like an invisible thing that people deal with. And so it can be
I definitely
hard.
felt like it was like this invisible injury, and that bothered me a lot.
Yes.
Like I had my kids, and I'm not gonna lie, like I looked like I didn't have kids. Like I was like the same size. I was back in my pants, and everyone was like, "Oh my God, you look amazing." And I'm crying inside because I'm like, you have no idea how awful I actually feel.
Yeah.
And it was, it was hard.
Yeah, absolutely. Yeah, I think it can be so hard from that perspective for sure. All right. Well, I don't want to keep us too much longer. This has been amazing. Is there anything else I have got my specific questions answered? So any other parting tips that you'd like to leave us with?
I am just so excited that you have made another product, because there's just so many. To have more shapes and sizes and options for everybody is just so important. I already got your sample and I have it in my clinic. I have the pamphlet up and people are like, "Oh, what's that?" And I get to be like, "Did you know like there's so many options here?"
Yeah.
So I'm super grateful that you've done that.
Thank you. So I know it's one of those things where it's like in my, when I first got this and started out, I was able to try other garments on the market, and most of them just didn't work for my body for various reasons. It was like they would provide the support, but they didn't feel comfortable. So it's like, there's got to be other people out there like me who are feeling this way. And I am finding, that there are, but yeah, I think it's a space where we need options, and we need people to be able to have more than one and have multiple options to find the best support for them. And so I'm excited to be in this space and learning so much and connecting with people like you in the community who are just so passionate about helping people, learn about these conditions, find support when they need it, and then, point them into resources that can be helpful. And hopefully more and more people are not like you and myself, or you and me, where you're completely blindsided and surprised when you find out you have pelvic organ prolapse. Like, let's not let that be the thing for future generations.
Yes.
So hopefully we can get there. But all right. Well, thank you so much, Dr. Beth. We really appreciate it.
It was great chatting with you.